Well, it looks like I went us past a minute. It's about 11:46 Central Time, so we'll go ahead and get started. Thank you all for coming today. This is the Graphic Novels and Comics Roundtable President's Program, titled Comics and Health, A Match Made in the Gutter. Nerdiest name I could come up with. I was very proud of it. So I am Matthew No, the incoming president for the Graphic Novels and Comics Roundtable. From now on, I'm just going to say GNCRT because that's a mouthful. And we are joined today by three excellent panelists who are going to talk to us about graphic medicine. And they'll tell you a little bit about what graphic medicine is once we get started. First up, we have MK Czerwiec, who is a nurse and a cartoonist. She's currently the artist in residence at Northwestern's Feinberg School of Medicine in the Center for Humanities and Bioethics. She is a co-founder of the field of graphic medicine, the creator of Taking Turns, Stories from HIV/AIDS Care Unit 371, a co-author of the Graphic Medicine Manifesto, and an editor of the now Eisner-nominated Menopause: A Comic Treatment. MK is also the comics editor for the journal Literature and Medicine. She co-manages the graphic medicine website, the podcast, the annual conferences, and in general, the online community of graphic medicine. MK, I'm going to skip the second paragraph of your bio. Next, we have Ian Williams, who is a physician and comics artist in the United Kingdom. He currently lives in Brighton. His graphic novel, The Bad Doctor, was published in 2014 and followed up in 2019 by The Lady Doctor. Both were critically acclaimed, and he's working on his third for the same publishers, provisionally entitled The Sick Doctor, which will be published in 2022. He studied fine art after medical school and then became involved in the medical humanities movement. Ian named the area of study called graphic medicine, building the website in 2007, which he currently co-edits. He is the founder of the not-for-profit Graphic Medicine International Collective and co-author of the also Eisner-nominated Graphic Medicine Manifesto. And then I'm going to stop your bio there too, Ian. I let everyone have too long of a bio. And our third panelist is Brittany Netherton. She's a librarian and currently the public libraries liaison for the Graphic Medicine International Collective. She's the head of knowledge and learning services at Darien Library in Connecticut. In 2018, she established a dedicated graphic medicine collection at Darien Library and has since created graphic medicine book club kits to combat health misinformation. Brittany has spoken about graphic medicine in public libraries in places such as San Diego Comic-Con, New York City Comic-Con, and the New England Graphic Medicine Conference. And what's really cool is Brittany and I know each other from grad school and somehow both wound up in New England from Kentucky. It's very strange. But so thank you to all three of you for joining us today and talking to everyone about, this interesting intersection of comics and health. I guess I should make sure that I give the pitches for Graphic Novels and Comics Roundtable before we dive in. We are dedicated to supporting the library staff in all aspects of engaging with graphic novels and comics, including collection development, programming, and advocacy. We're currently seeking volunteers for the upcoming year for a variety of committees and projects. You can find out all about that on the ALA GNCRT website. And if you don't see an idea that you'd like to see happen, feel free to get in touch. We're always looking for new possibilities. And don't forget to join us for the GNCRT social tonight at, I believe it's at 6 p.m. Central Time. You can find all the details about that on the ALA GNCRT website. So now we will dive in. And so I'm gonna step back and ask you all to answer some questions. And so really, I asked this of everybody, like, what is your origin story? How did you get into comics and how did you wind up doing graphic medicine work? Ian, we'll start with you on that one.
Thanks. Hello, everybody. Thanks, Matthew, for inviting us on this. I read comics as a child, obviously. It was, comics were a big thing when I was a child. Things like 2000 AD, which is still very popular over here. Then I kind of fell out of comics a bit, but started reading graphic novels again when they became popular. So people like Chris Ware, Daniel Close. There was a kind of resurgence of sort of art graphic novels, if you like. I got in, well, I went to medical school, but I've always been into art. And after medical school, I went back to art school and did postgraduate studies in painting and printmaking. And then I was trying to find a way of combining art and medicine. So I did an MA in what's called medical humanities. And during that time, I decided that the link between art and medicine for me was comics. And that was mainly because I found Brian Fay's comic, Mum's Cancer, actually in the Tate Modern bookshop in London. And I found that and I thought, this is interesting. Somebody doing comics about healthcare issues. I wonder if there are other similar graphic memoirs. And so I decided to do my dissertation on that. And the more I looked, the more I found. And, you know, I found lots of cancer memoirs, quite a lot of memoirs about mental health. So I started doing my dissertation. I was reading all these comics. And then rather than get down to writing the dissertation, I mean, I did write it eventually, but I kind of thought, well, I've got all these notes. I'm going to set up a website and put this online. And it was a kind of procrastination move, really, so that I didn't have to start writing the thesis, if you like. And I thought, well, a few people would be interested in it, maybe. And I put it online, and suddenly I called it graphic medicine because I thought that sounded cool for a website. And the medicine bit being sort of about like medicine you take, like a panacea, rather than it being about the profession. Put it online, and within a couple of weeks, people started contacting me from around the world. Michael Green was Professor Michael Green, Penn State University, was one of the first people saying, hey, I'm a doctor, I've just started teaching medical students during using comics. MK was one of the first people to get in touch as well. And then it kind of just went from there, really. I mean, and it sort of changed my life. So comics and graphic medicine and comics basically changed my life totally. And that's not, you know, that's not an exaggeration. They totally changed my life.
Thanks, Ian. MK, that's a perfect segue over to you.
It is, and I agree. I end up in the same place, finding graphic medicine and the intersection and the power of this medium in this context absolutely changed my life. And there are some really interesting synchronicitous parallels between Ian's path and mine. At the same time, I was also finishing up a degree in the medical humanities in an effort to bring together my interest in the arts and the humanities and bioethics with my practice of healthcare. Feeling like I had been a nurse during the AIDS crisis, and during that time, just really a way to survive, I stumbled into making comics and found this medium to be so powerful as a reflective tool about my practice as a provider and the kinds of things we were witnessing during the AIDS crisis. And of course, that comes all back up during COVID as just what an incredible coping tool making a comic, the simple act of making a comic could be. But believe it or not only were Ian and I both kind of doing that bringing together the fields of the health humanities and our practice as providers together at the same time, but around the same time, I also walked into the bookstore at the Museum of Contemporary Art in Chicago and saw Brian Feist's Mom's Cancer. And it blew my mind and made me just in the last year of my program, in my master's program, say, could comics have a serious place in the discourse of health and illness and caregiving and disability? And then I reached out and found Ian, and he'd been doing the same sort of exploration. And then again, yeah, the rest was history. As far as like comic artists who are huge influences on me, I can't pass without mentioning Linda Berry, who just, I was a fan of her work in college. I was not really into comics that much as a young person, other than maybe newspaper comics, Calvin and Hobbes, Peanuts were probably the first books I checked out of the library. But yeah, the rest is kind of history, that just this explosion happened of like how powerful this could be, and yeah, moved on.
Great. Brittany, did we get you back? I think we dropped you for a minute. We can't hear you.
Yes, my computer froze, so I'm on my phone now. Sorry about that.
That's great. That's totally fine. So did you hear the question?
I did not hear anything after you got
No worries. So we're talking about like what your origin story into comics and into graphic medicine is. We've heard from you in an MK, so.
Yeah, so for comics, for me, it started when I was very young. We used to buy this cereal that had a comic on the back of it that you could get all the cereal boxes and get the whole story, and I would read those over and over. And then I was buying Pokemon comics and reading, you know, the newspaper funnies and things like that. And then for graphic medicine specifically, that was a few years ago when I took over purchasing of the adult graphic novels at Darien Library. And one of our strategic goals was related to health and wellness in the community. And as Matthew said earlier, I knew him from grad school and I saw the work that he was doing in graphic medicine. And it just tied in so nicely with that strategic goal. I asked for if I could have a little budget to maybe create a small collection, and then it just kind of grew from there.
Awesome, thanks. So I mean, all of you have been involved in graphic medicine, some of you coining the term, some of you starting collections more recently. But so, you know, since you've been involved in the area, you know, how have things changed since you first started with all this? Ian, do you want to start with that?
Well, I mean, it was very niche to start with, and in the 13 years, is it now, since I set up the website, I mean, it's kind of feels like it's gone much more mainstream, and especially in North America. I mean, it's kind of, you know, I'm just staggered every conference we have. You know, I meet people who are now teaching courses on graphic medicine, libraries that have collections called graphic medicine, and I mean, it's just it's kind of mind-blowing. I mean, it was very niche. I spent so when I set up the website, and when people like MK and Michael and Susan Squire started getting in touch, there wasn't you know, very much written from an academic point of view. When I was doing my dissertation, I found a few papers online about health-related themes in comics. So Susan Squire was one of those authors, Jared Gardner, Hilary Chute, and you know, comics studies. I found this thing called comics studies, and I started going to comics studies academic meetings and sort of evangelizing, really, and also going to medical humanities meetings and just talking to healthcare professionals about comics. And in the early days, you know, I got a load of, you know, this is mad kind of thing, you know, or, you know, I was showing kind of like graphic memoirs, and people going, you know, I thought this was about comics. Those are not funny, you know, cancer's not funny. Why are you showing us this sort of? But I think, you know, over the years, comics has become much more accepted as a you know, a literary form, if you like, and we, you know, hopefully now we don't have to kind of keep providing the comics are not just for kids kind of spiel, although, you know, some people still think that. So it's just moved kind of mainstream, and people are kind of accepting it, and I'm just, you know, this massive community is built up around it. It's amazing.
Yeah, I'll just hop in on that. So I had done research about the intersection of comics and HIV/AIDS, because that's what my graphic memoir was about. And I went to the National Library of Medicine and thought I would find this whole treasure trove of, because so many public health departments used comics as a way to teach the important information around HIV/AIDS. And the truth was that most of that was all just lost to history. And what was amazing was that when COVID started happening, what really blew my mind was not only thanks to, of course, the internet and the worldwide community of graphic medicine, people started posting those comics about the intersection of COVID and what we needed to learn, the public health information we needed, you know, about washing your hands and about like transmission and mask wearing and navigating the lockdown. All that stuff just started really exploding on social media. And so having seen how much of that was lost during the AIDS crisis, I wanted to make sure we archive that, which we have on our graphic medicine website. But what amazed me was how many mainstream outlets picked up using comics as an incredible way to communicate what was happening within the hospitals. Again, the information that needed to be disseminated, places like the NBC News website, major outlets were using comic, the National Public Radio. You just were seeing comics really doing that important work very prominently during COVID. And that was a real switch and a really exciting way to also know how much we could archive that so it won't be lost to history.
Brittany, do you have any thoughts on how graphic medicine has evolved since you got involved?
Yeah, so I am much newer than Ian and MK, but it even in the last few years has expanded in public libraries. I remember when I first got started, you know, I would go and speak on it and maybe be the only public librarian in the room who was working with it. And now the last time I spoke about it, I had at least 10 other public librarians who were doing either book club kits or creating dedicated graphic medicine collections at their libraries. So that's really cool. And then I'm also starting to see on some of our streaming services and borrowing services that graphic medicine is becoming a known category on those as well. Comics Plus comes to mind. They had a dedicated graphic medicine category, which I wouldn't have seen a few years ago. So that's really cool.
Yeah, and seeing it evolve to be considered on our ebook platforms is huge, because before, this is such a wide ranging field that trying to narrow it down on a platform like that can be difficult, even when you know how to search on there. Mm-hmm. I just want to shout out, I think Susan Brown is on our call here from Ypsilanti District Library, and that was one of the first public library collections in graphic medicine that I've ever seen and remember coming around. And that got started with one of GNCRT's Eisner grants, or expanded with one of those Eisner grants. And I think MKU did a program there, right? So do you want to talk a little about that, and then Ian and Brittany, you can chime in with other programming that's happened in libraries over the years.
Yes, I did. I did a program there. It was really wonderful. It was my first chance to meet Roz Chast, who did just an amazing keynote there, and I saw what a wonderful, vibrant support community she has. But yeah, Susan, it was such a great memory and such a great experience, and really shot in the arm as far as this crazy idea of all of us wanting to do this. It was so exciting to see you do that work. So thank you. And I see from the chat that you're retired. So congratulations on the work that you have done in your career.
Thank you. Yeah, we won the Will Eisner Growth Grant in 2014, and it's just a little piece of history. I feel like I'm grandma graphic medicine now. It's been 7 years, but it was exciting that one of the first Will Eisner grant was awarded on a graphic novel research topic. So kudos to everyone who started this, and earlier I picked up on it by researching titles for our collection on graphicmedicine.com. So thank you for starting that. It's it was a big part of my career. So
that's great. Thank you, Susan. Ian, you've done programming with libraries before, haven't you?
A little, probably not as much as MK, or probably not as much as you have. But my main library contacts that I've worked with have been the Welcome collection in London, they sponsored the Welcome Trust, which is their kind of funding wing, if you like, sponsored our first conference in London in 2010, and they have been very supportive generally, and they kind of got it early on, and started to kind of collect graphic medicine items, and had the first sign that I ever saw that had graphic medicine on it on a bookshelf was in the Wellcome Collection shop in London, and that was very exciting. So, but I kind of feel that librarians and library studies people really got on board really early on. So like Martha Cornock was somebody that was really involved early on, just got in touch, started kind of, exchanging kind of information, exchanging links about sort of suitable graphic novels, and sort of really championed it. And generally sort of, yeah, people in libraries, they've been on board since, virtually from the beginning. It's been amazing. I haven't really done much kind of programming and stuff like that with regards to libraries. I'm just trying to trawl my memory to see if there's anything else in particular. But yeah, I kind of just would like to thank the community of people. And probably, to be honest, one of the major sort of changes that sort of happened to graphic medicine with regards to kind of, bringing the library community was like you getting involved, Matthew. I mean, you've been an absolute powerhouse. So, yeah.
Well, thank you. And we'll have to get you involved in more library programming. Have
Yeah,
to have you come do author talks, come do author talks and things.
Yeah.
Can I do a shout?
Oh, sorry, MK, can you unmute again?
Yeah, sorry. Can I do a shout out quickly to a library program? Because I think it would be really interesting for people to consider something like this. So I've been working with an organization called Reimagine End of Life in New York and actually San Francisco. There were programs in each of the coasts here. And it's driven by my work as a nurse and seeing during the AIDS crisis, so many people who were able to talk about their wishes around end of life. The more able they were to talk about it and face it with their loved ones, the more I felt like they had what could be conventionally considered a good death. And by that, I mean, they died where they wanted to be, with whom they wanted. They were just clear, right? And so one of the things I thought comics could really, really powerful about is to bring together having those difficult conversations with your loved ones long before you're in an ICU bed and they're making a decision for you. Could we use comics to help with those conversations? So I've been doing work with a lot of colleagues in the narrative medicine program at Columbia in New York. And so what we decided to do with Reimagine was we had at the 53rd Street Library, we just did a whole series of programs. One was an exhibit of art called Death Panels of comics that address end-of-life issues. And so it was really just blown up, really large comics about end of life, which, believe it or not, there are so many wonderful comics that help talk about. Some are funny, some are very serious, some are educational. So we had an exhibit that ran, as you walked through the library. So everyone who came into that library over a period of about a month looked at those comics. Then there was an exhibit of books at the end of the hallway of a ton of graphic novels that talk about end of life. Then we did programming with people like Jennifer Brokaw and talked about hospice programs. We did all kinds of live events in the library. And it was just a really wonderful way to engage people who were just wandering around, again, with follow-up information they could take with them of how to have these difficult conversations, and comics became the tool to do that. So it was a great suite of programs that I feel like did a lot of work in that regard.
Yeah, that's awesome. Brittany, I know you already mentioned doing some book club kits, but can you tell us more about how those work and what other programming you've been doing in the library?
Yeah, so we have 11 different book club kits themed around different topics. And the way that we ended up packaging ours, they can be used by one person or they can be used by a group of people. So if somebody maybe isn't part of a book club or doesn't really want to talk about those things with people, they're welcome to check it out themselves and still use the discussion questions to guide their thinking. We did have a group to do sort of our test run when we first launched them. They were a group of non-comics readers. They were actually very, very hesitant whenever I told them that they would be reading comics. And it was really nice. They came, at least 3 or 4 of them came to me afterwards and said, you know, I'm so sorry I gave you such a hard time about not wanting to read these comics. These were so good. And they had read our mental health kit, which is Marbles by Ellen Forney and RX by Rachel Lindsay, which they loved. And then in tandem with launching those kits, we had Rachel Lindsay to come and give a presentation at our library, which was so amazing. She talked about kind of like what it's like to relive your trauma in creating a memoir, and what it's like to go through that as a writer and as an artist, and then how it's impacted her life post publication, and, you know, what it feels like to have these like really intimate moments of your life out there for everyone to know about. And it was just fantastic to have her there speaking, and then be able to launch the book club immediately after.
Yeah, that's great. And yeah, no, Rachel is a great speaker. We had her at Countway as well. And she was a big hit with, you know, the medical students and pre-pharmacy students at MCPHS as well. Like these memoirs speak to a large, wide audience of people. Everyone at some point is going to, you know, need a caregiver or be invested in the healthcare system. And so there's all kinds of entry points to this. But something you said, Brittany, about, you know, about what Rachel talked about there, the re-trauma of sharing her story and about creating memoir, that makes me think of another set of questions I had for you all, for Ian and MK. How do you all approach telling these healthcare stories when you've got things to take into consideration, like, you know, medical accuracy and privacy, and both of you put some of yourselves into your works. MK, taking turns in particular is very personal for you. And Ian, I know parts of The Bad Doctor are related to your life, but it's very fictionalized. So how do you all, you know, approach this piece of storytelling in medicine?
Am I going first?
Whoever wants to run with it.
Yeah, so my books, my two graphic novels so far are The Bad Doctor, which is a kind of fictionalized memoir, if you like, or it's sort of got autobiographical elements in it. It's about being a doctor. It's about medicine, obsessive compulsive disorder, cycling, and heavy metal. That's the elevator pitch. And then the follow-up was The Lady Doctor, which came out in 2019. And both have, you know, both are loosely based on things that I've experienced. So I figured that I didn't want to do a straight memoir, because I figured actually my life wasn't that interesting, but I did have really quite severe OCD at medical school, and sort of it continued whilst, well, kind of continues, but it sort of continued throughout my medical training and being a doctor. So a lot of it, I was a GP, a family doctor, for quite a few years up in a very small town in North Wales. And that's when I started doing comics, but I did them under a pseudonym initially, because I didn't want any of my patients to find out I was doing cartoons. Not because I was putting confidential information out there. It was more, I didn't want anybody speculating on it. But obviously patient confidentiality, the ethics surrounding that is extremely important. So I handled that by basically disguising everything as much as I could. So most of the characters are not really based on, well, they're certainly not based on individuals. They're kind of fictionalized composite characters. The stories and the situations are sort of based on my experience, but changed around a lot, and also kind of based on things that I could see happening in certain situations rather than what did happen. Parts of it probably are fairly, you know, verbatim from things that happened, and I've just basically sort of try to anonymize it as much as I can, but I am conscious of those things. I mean, doctors are really good at taking patient stories and then, you know, putting them out there for their own aggrandizement and what have you, and that's kind of really stealing the patient's story, and then, like, you know, getting kudos because of it. But that's what happens in medical journals. You know, we anonymize the patient and they don't get any credit for it. You know, it's the doctor, oh, I've diagnosed this is what happened. Anyway, so I've tried to avoid that, and I suppose the biggest element in avoiding that is that most of the kind of anecdotes and vignettes are more about the doctor than the patient. So it's like the doctor, it's like how the doctor is responding to the patient. And the same with the lady doctor as well. It's more, the focus is not really on the patient, it's more about the doctor's response to any particular situation. But I don't want to get sued, so I try to kind of anonymize things as much as I can.
Yeah, and I'll pick up with that. One of the reasons I was studying bioethics in the medical humanities was because I always knew I wanted to make comics about this place that I worked, which was an AIDS unit in Chicago, that I just felt was so different from any other kind of hospital environment in terms of the connection of the community and in terms of the commitment of the staff and the way in which the staff and the community interacted with patients. And I thought I wanted to, first of all, preserve the history because I'd learned that it wasn't recorded, and also because I felt like I wanted to look at what could be exported from that into how we provide healthcare. And so I studied bioethics because I really wanted to attend to the important issues around story and what were my ethical and legal responsibilities in representing my patients in this place, but also what do each of the disciplines within the humanities teach us about how story works. But to your question, so the way that I managed the privacy issue, because obviously I'm bound by HIPAA, which is the Health Information Portability and Privacy Act. I'm bound by, there's no information I can share about patients, obviously, and just ethically. And to your point, Ian, these aren't my stories to tell. So first of all, I focused on, kind of as you were saying, Ian, realized that the only story I really had license to tell was my own. And if I wanted anyone else to come in and tell a story, then I needed to talk to them and let them be involved in the project. And so that's why I did an oral history of this place. I did a full 23 to 25 narrator oral history. And so that when I was, when you make a comic, you're literally putting words coming out of someone's mouth when you draw them as the narrator. And so then the words that come out of my collaborators' mouths are literally their words from the oral history. And then in terms of patients that are represented, obviously they're going to end up in there. I really struggled with this because it was about the AIDS crisis. And if you're familiar with the Names Project, which is also known as the AIDS Memorial Quilt, one of the goals of that was to remember their names because they were lost, because that, we don't want to forget that happened or who these important people were, who perhaps could have not been lost if the government had acted more quickly and aggressively. The whole point of the quilts is that their names are on there and you keep their names alive. But of course, then I can't do that because I know their names through the medical record. So it took a lot of struggle with this. So rather than anonymizing patients, what I did was I took 5 very different aspects of individuals who are very real and combined them into one fictional character. So perhaps it'll have the physical appearance of one person, the medical trajectory of another, the kind of profession or backstory of another, and I combine them, real people, into single people. So that's how I attended to that. And then the other piece is this medical accuracy. That just feels really important. When we first started running comics in the Annals of Internal Medicine, graphic medicine section, which was a huge coup, right? Like for the first time, comics are going to appear in a national medical journal. Huge coup. One of the really only requirements they had was that if any medical information is represented, it has to be factual. And that's critically important, right? Especially in educational comics, whatever we do, but even in memoir, right? Like a book like My Degeneration about living with Parkinson's, you better make sure the medical information is right. So the way we always talk about that is just really kind of run it by a specialist, right? Verify your facts. I try to do that with as much when I talk about medical information, but so yeah, just so this is my book, Taking Turns. I just thought I'd throw the cover out there so you can see it, but it's about being a nurse, and there are a lot of resonances, unfortunately, with COVID recently. So
Thank you both. And I recommend everyone read all three of those books. And My Degeneration, which is, just, it's fabulous. Brittany, following up with this medical accuracy piece, I'm curious if you have any insight or suggestions for library people on how to handle graphic medicine in the collection. We are, as librarians, are not necessarily medical professionals. So how are we talking about this collection with our patrons? How do you approach that?
Yeah, so it's really tough. Like Matthew said, when I'm buying graphic novels, I have no medical background whatsoever. So I'm relying really heavily on the same sorts of things I would do for a regular nonfiction collection, reviews, and like people that I trust in the community promoting those. I find that whenever I'm promoting them to our patrons, I don't necessarily think about accuracy as frequently as I think about the format itself and whether it's an accessible introduction to a graphic novel. The accuracy piece comes in before they ever make it to the shelf, right? Whenever I'm deciding whether or not to buy something. But when I'm actually sharing it with patrons, it's more about, is this patron a comics reader, in which case I can pretty much throw anything on the shelf at them and know that they'll be okay? Or is this somebody, usually whenever I'm promoting the graphic medicine titles, it's somebody who's not a comics reader. And then I need to be kind of aware of what sort of level of a comic I am giving them, because some are harder to read than others. So I think that like Mom's Cancer, for instance, is a fantastic intro comic to give somebody, whereas maybe, Epilepsy, I find to be a little bit more difficult. So I tend to think more along those lines whenever they get onto our shelf and I'm promoting them to people. But for purchasing, I follow the same collection development policy that we follow for any other nonfiction title, just to make sure that, we're not putting anything on the shelf that could be harmful or contains information that is not correct.
Yeah, for sure. Sorry, 1 second. It's interesting to me, Brittany, that you also use Epileptic as your go-to example for a difficult comic, because that's always mine as well. Like, I can't pull that off the shelf and hand it to anyone. It's a valuable and exceptionally constructed comic, but it's like an advanced level of comics readers.
It really is. Yeah. I
Um,
also have to think about beyond just the format. I have to think about the content sometimes when I'm recommending these to people. I know, Matthew, you and I have talked about, my brain is not working right now, the Rosalie Lightning.
mhm.
Is a fantastic graphic novel that details, this father's grief at losing his child unexpectedly. I can't recommend that to everyone. I have to see what this person, this patron who's coming to me needs, what they're looking for. If somebody is actively going through the grieving process, I'm probably not going to give them that book, because I don't think that would be a great, thing for them to delve into. Whereas if it's somebody who, has a loved one who's going through the grieving process and wants to maybe understand what they're going through, then I would absolutely hand them that book.
Yeah, definitely. Ian wanted to come back real quick on the medical accuracy part of that other question.
Well, just to pick up on those two books that Brittany just mentioned. I mean, Rosalie Lightning, I can't read that because I've got young kids and I just can't. I haven't read it. It's on my shelf and I can't bring myself to read it. Nicholas Streeton's Billy, Me and You. I'm glad I read that before I had, our first child, because I don't think I could read it now. But an Epileptic is a brilliant example of, so early on when I was giving talks about, graphic memoirs with medical themes, somebody sort of said, I bought Epileptic for a friend of ours whose daughter has just been diagnosed with epilepsy, because I thought it'd be like uplifting for them. And I said, well, have you kind of read it? Have you read it? And they went, no. Oh, I thought it'd be funny because it was a comic. I was like, yeah, well, not really. But I'd just like to bring up the medical accuracy. I maybe see it in a sort of slightly different way, because I think the area of comics and healthcare that I'm most interested in is memoir and autobiography. And a lot of these, a lot of memoirs are written, well, most memoirs are written from a very subjective point of view. Some authors make an effort to kind of bring in mainstream medical thinking, if you like, mainstream healthcare thinking, and they have the kind of educational break in the middle of the memoir. Now, this is what this condition is all about. But I kind of think one of the values of graphic memoirs that are about medical conditions is that they are so subjective, and that they don't have to. Most of these are written as works of self-expression or works of art, and I don't see any need for medical accuracy in them. I think, library staff are in a difficult position if you're, going into the realms of like bibliotherapy and having to recommend things. That's a really difficult position to be in, and I'm glad I'm not in that position. But I kind of actually value the varied viewpoints, I suppose, in these things, some of which may be kind of wildly inaccurate from a mainstream medical point of view. But if we're not recommending them as therapy, I think that's really valuable. I think that's why educational comics are so hard to do, because if people have to toe the line with the kind of mainstream evidence-based medical thinking, it kind of really limits people have this anxiety about it, making everything so accurate, and it kind of, often it can be done really well, and we've got, people within the graphic medicine community who do it like, brilliantly, but a lot of it is kind of really dull,
We'll say for our collection, I mostly buy memoir, both because that's what circulates well in our community, and because I find that a lot of the graphic medicine titles that are coming across my radar are memoirs. And I always make sure when I hand them to people to say, this is just one person's experience. And it was why it was important whenever we were building our book club kits to have 2 books in each kit. So that we could say, this is the same topic, but these are 2 different perspectives on that topic, to really, drive home that point of everyone's experience is going to be different, and they're all valid.
Yeah, for sure. And it definitely gets complicated for library work. Like, the one that always comes to mind for me is, I'm in a medical school. I don't have to worry about a lot of these issues. I build a collection for research purposes and for reading purposes, but things like Erica Moen and Matthew Nolan's sex education comics. There's a recent one for, that age range. They've got Ojoy Sex Toy, which you may not, be able to access in a high school library. But their most recent ones, oh no, now I'm blanking on the title. Let's talk about it, maybe. That one is fantastic. And, there's a level of, thank you in the chat. There's a level of anatomical accuracy that you have to have in that kind of a comic. And so balancing that and then getting that out there on the shelf, it raises some questions about shelving and should these be one collection, or do you put them in your already existing comics collections? And it just kind of depends a lot on, your library environment, I think. I do want to get to some of these questions in the chat, so we'll dive into those. I'm going to have us end with a specific question from me for all of our panelists, so I'm going to do the questions in the chat now. So the first one I see is from Susan Brown, and she asks, is graphic medicine BISAC, I'm not sure how to pronounce that acronym, category yet? I noticed that the Penn State titles were searchable by Graphic Medicine and Baker and Taylor's database, but no other titles came up under that category. Might be a helpful step for librarians that could be advocated for. As far as I know, it's not been created as a category yet, but I don't work with Baker and Taylor. I think you do, right, Brittany? You might be able to answer that one a little bit better.
I actually don't know the answer to that. Usually when the graphic medicine titles come across my radar, it's because, you know, it's in the Facebook group or on graphicmedicine.org or somewhere else that I'm seeing them. So I've never actually gone into Baker and Taylor and tried to just search by BISAC for it.
And that might be something to advocate for sure. It would be more, I think it might be more, my experience with that category is my wife used to work for a bookstore and they use that category a lot more than I've seen in libraries. So it might be a way for bookstores to better advocate for these comics as well. Another question, let's see. I love comics and would really like to, from Amanda Tarbett, I can't see your full name. I love comics and would really like to start a graphic medicine book club or other program at my library, which serves graduate health profession students. Any tips for running a successful program targeted towards very busy adults of varying ages? Anyone feel free to jump in on that one.
I wish I had better advice. I think the programming is always so difficult, especially once you add in varying ages and then schedules that are difficult. I would say right now, if your library is still doing Zoom programming, would be a great time to try a program because you can meet people where they are, especially if you can record it and provide it to them to watch after the fact. It might be a really good opportunity to sort of like get your foot in the door to open up possibilities for more in-person programs down the road.
Definitely. I can answer that a little bit. So we've run book clubs with our students at Harvard Medical School before, and they usually tie up with one of our other like months of programming. So mental health awareness or suicide prevention, where our approach is to provide the book to the students. Like it's not maybe the best advice for everyone. Like we're in a position where we can buy a copy of the book for every participant. We usually cap the number of participants between 15 and 20, and then invite people to read the book and come have a conversation. I also would recommend, you know, if you've got an idea for a program that involves a specific comic author, it can't hurt to reach out to them and see, you know, if they're available, if they're interested, if they can, you know, try to make sure you're offering an honorarium as much as possible because this is labor. But, you know, comics artists are usually willing to work with libraries to make these things possible. It's just, you know, don't be afraid to email someone and ask them. Let's see, another question. Jennifer asks, I am somewhat new to graphic medicine, but have truly fallen in love and admiration. I'm a grad student thinking about my grad project with graduation on the horizon. What research avenues or ideas need more investigation? Where is research on the subject lacking? So I think MK and Ian both probably have good answers for that one.
Yeah, I'll let you go, Ian. Basically, I think that, you know, we are enthusiastic about the use of comics in healthcare, but medicine is evidence-based, right? So anything that really provides evidence of use, evidence of impact, whether it's on, you know, readers in a library system or students in a program, really like that's just such a great contribution to this field is evidence of impact. So that would be my answer. And I'm sure we all have maybe different thoughts on that.
Yeah, and sort of, well, picking up on what MK said, educational comics. I think like educational comics have been, you know, around since 1950s. You know, comic strips have been used as sort of patient education in, you know, by government departments from the 1950s onwards. They're widely used in like public health around the world, really. But there are very, very few studies or, you know, an overview of whether they make any difference, whether, you know, they are effective. I mean, I mentioned educational comics before, and it's kind of a bit of a bugbear of mine because I think they're so hard to do well, and so many of them are pretty dreadful. There are good ones out there, but they're really hard to do. And you know, somebody should look, you know, do some kind of like overview of educational comics from both an impact point of view and a history point of view, because they're kind of, people get huge funding to do to produce huge public funding from public bodies to produce comics on educational material, and as far as I can see, there's very little actual evidence that they make much difference. And they're also the whole idea of using comics as education is often kind of freighted with ideas about the target demographic, like, oh well, comics are good for people that don't read very well, or comics are good from so it is a complicated thing, and I think that would be a good area to look at.
But I think that I'd like to think that the research around this is starting to change. There is a study that University of Chicago, which has been amazing, their research team and involving me as a cartoonist early on in the grant process, so really early in the project, to help have stakeholder involvement in the content of the comic. So yeah, like, the history of research in the United States in healthcare in many areas is, some people who decide what someone else needs create an intervention that is their goals, right, and their needs, and then puts it out to the target population, as opposed to a more ethical way to do that is the target population, the people who are a part of what the struggle or the issue or the diagnosis, whatever it is, are involved in the creation of the comic, are involved in the content and the representation and all of the things that are important to attend to. That kind of stuff, I think, is really critically important to then the outcome of the comic. And I agree with you, Ian, that unfortunately, a lot of the ways that this is couched is like, well, the people who are most impacted are people with low reading levels, or minority populations or whatever, which is such an odd way to put it, right? And even in the study that I would like to tout, that's something that did get mentioned in the outcomes analysis. But the part I like to focus on is a study where they were looking at parents' involvement in the use of a computer in a clinical environment in their child's pediatric visits, and empowering the patients to say, oh, hey, can we look at that screen together, or can we step away from the screen, and basically telling them what their rights are. And the outcomes of just using a simple comic in the waiting room, and then a follow-up phone service months later, was that like 90% of the people, if I'm remembering this correctly, but a very high percentage of people remembered that comic. And they remember like just the great visual of it. But again, unfortunately, it was couched in some interesting ways. But the point is, there's starting to be some research that starts to look at the evidence, which is, to your question, what is important. Yeah.
Awesome. Thank you both. And so the last question I see in the chat right now, I think may have been answered in the chat. It's a question of, are there graphic medicine titles out there that deal with mental health? And mental health and cancer both tend to be the largest section of titles in this genre, subgenre, however we're calling it now. But so I guess I would just ask if any of the panelists have a favorite one in that category, or a favorite couple they want to plug.
Well, Rachel Lindsay, RX. The Bad Doctor deals with mental health as well. Yeah, I mean, I think mental health is quite well represented within graphic medicine. But Marbles, of course, Alan Forney. But RX, I think, is one of your questions, Matthew, was what's graphic novel has stuck with you over recent years, and I think the Rachel Lindsay's RX is just amazing. I think it's just brilliant, which is about her manic breakdown basically and her experience of hospitalization.
Yeah, if I remember correctly, we met Rachel at the 2018 conference in Vermont, and she gave you that book and you read it on the plane and had a review ready when you got back home. Like that was an immediate hit for everybody.
Yeah.
Brittany or MK?
I agree. Rachel's book is definitely really high on my list. I also really love the Sarah Scribbles books as like just a really simple look at millennial anxiety, I think is great. And then Hyperbole and a Half, also for the same reason, just a really approachable, funny, like looking at the page and saying, oh, that's me.
Yeah, I'd love to give a shout out to a book that is really influential for me, and I've been involved in this process early on. But it's called The Most Costly Journey, or in Spanish, it's El Viaje Más Caro, and it's stories of migrant farm workers in Vermont, drawn by New England cartoonists. And I bring this up in the context of mental health because one of the things I love about the origin story of this book is that when Ian has spoken in the past about, and he alluded to it here, is that when originally coming up with the term of graphic medicine, it was sort of a bit of a joke, right? Like that the comic itself could be the medicine, right? And this book is like the closest example of that being the case. So there was a nurse practitioner working at a clinic for uninsured migrant farm workers in Vermont, in dairy farms, and people were coming in with these sort of symptoms that seemed what she decided really were kind of trauma related. And the trauma was, of course, their migration story and the trauma of being sort of, a heart in one place and another, and all these things that were having physical manifestations. And so she got together with someone from the Vermont Folk Life Center and people from the Center for Cartoon Studies in Vermont, and they paired them up, and people shared their stories, and cartoonists did the stories in comic form, attending to all of the ethics of representation and sharing the stories of people, and then gave these were originally not a single book, they were just zines, they were individual zines, and gave them back to the community, right? In healthcare, we're always taking people's history, but we don't give it back. And this was basically bearing witness to their experience and giving it back in English and in Spanish in these zines, and putting them into the clinics in the community. And so, and they're just wonderful stories. And in this book is the first time they're kind of gathering all those zines into a single book. And I can't endorse it enough. I think it's just a really great example of graphic medicine.
Can we just also mention, because in our first conference in 2010, 2 out of the 3 keynote speakers, if you like, were talking about mental health issues. So that was Philippa Perry with Couch Fiction, which I think has just been reissued, like her daughter Flo Perry has sort of just re-illustrated that. So that's a comic book about being a psychotherapist. And Daryl Cunningham's Psychiatric Tales, which was kind of actually one of the inspirations for graphic medicine, because Daryl's book was one of the other books that I kind of initially found, with when I found Brian's book, so Psychiatric Tales as well.
For sure, yeah. Thank you all for all of those great recommendations. We've got like a minute and a half left. So the last question I wanted to throw to everybody, you may have sort of answered this already. I know MK had that book ready to go, but I was going to ask everyone, what are you working on right now? What are you reading right now? That, like, what can you tell us about what you're working on? And then what's a book that you're in love with right now? And then just the last word from each of you, just tell people where to find you if they want to follow up. So Ian, do you want to start with that?
Well, I'm working on the 3rd volume in my Bad Doctor series. I'm also sort of the series is it's been sort of optioned for kind of adaptation for TV. So I'm kind of working with the writers on that as well. You can find me via the Graphic Medicine website, or at my website, ian-williams.co.uk. What do I love? God, that's like sort of, I haven't got a sort of pre-prepared answer for that. I love the Wendy series, which is not at all graphic medicine, but Walter Scott, Wendy, the Wendy series, which is also up for an Eisner Award, I reckon. I kind of love that at the moment.
Great, thanks. MK?
So I'm currently working I'm in the research phase for what I think will be my next book, which I thought was going to be about taking care of elderly parents, and I thought it was about coming out, but it's about those things. But mostly I think the research is more around adoption and the adoption process in the United States, and why so many lies are involved in adoption in the United States. And I know a few other people working on projects like this, so I've been really inspired. And so I'm in the research phase of that. But books I'm in love with currently are this book called Maker Comics, Draw a Comic. And I stumbled into it and I thought, oh, it's just going to be a silly little thing. But I'm incredibly inspired by, first of all, it starts in a library. It's a great library book because it starts with a young woman whose grandfather wanted to found a library of comics, and he died. And then she wanted to pick up this legacy. And then there's like a bad guy. But the point is, it is the most concrete for any of you who are interested in making comics or learning to make comics. Believe it or not, it has the most concrete information about the tools to use, the kind of paper, the kind of pens, how to use a nib pen. Like, I mean, I've tabbed all these things for my students of like, you know, what, all that information. And for a simple, just kind of book you wouldn't expect, it has a lot of these books about making comics don't have enough detailed information about that stuff. And this one kind of does. So I had to give it a shout out.
Thanks, MK. And rounding us out, Brittany?
Yeah, so during COVID, we had to take our graphic medicine kits out of circulation, and we were just able to put those back out. So I'm going to try to hit the ground running, getting those back into people's hands. What I'm reading right now is COVID Chronicles, the comics anthology, which has just, you know, lots of different people contributing works.
Can you say which COVID Chronicles? Because there's actually 2 with that title.
Oh my goodness. It's the one with like the street scene on the cover with all the people, and then there are like buildings in the background.
I think it's the one MK's holding up right now. The one from
It is
Graphic.
that one. Yes, that's the one that I'm reading through right now. It's just amazing. It's so good.
It's a great example of an anthology.
It's so good. I think you said to say where people can find us.
Yeah.
I'm on Twitter at B_Netherton. And then if you go to the liaison page on the graphic medicine website, you can find me there as well.
Awesome. Well, thank you all so much for coming and attending our panel, our President's Program on Graphic Medicine. I hope that it was informative and inspires you to work more with graphic medicine in your own libraries. I'm sure everyone on this panel is happy to answer further questions later. The easiest way to reach any one of us is to use the contact form at graphicmedicine.org, and then we can get back in touch with you. So have a great rest of ALA and see you all soon.
Thanks for tuning in, everyone.
Ian, that was slowly devolving into a queen wave, I think.